I'm now joined by Dr. Kimberly Martin. She is a pediatric infectious disease physician with OU Medical. Thanks, Doc, for taking a short time to talk about COVID-19. So even though this pandemic is affecting the older population, are children susceptible to COVID-19?
Thank you for having me. It is a very good question. We are basing much of our information on Chinese data because they had the outbreak much sooner than we've had in the United States. And in looking at many children who were infected in the Chinese population, many of them had very asymptomatic or mild or moderate symptoms. So kids can definitely be affected by the virus, but thankfully, many of them will have very, very little symptoms, could have cold symptoms, so upper respiratory infection like symptoms, runny nose, red throat, cough, could have some GI symptoms like vomiting and diarrhea.
So what should parents do to keep their kids safe?
Really doing all of our normal basic things that we try to tell children to do to prevent infections, wiping down in your home high touch surfaces, and really continuing to do what the United States has been really trying to push is staying in your home, not being around sick people, and really just trying to do the social distancing at home.
So what are you seeing out there in the community? You may not be seeing kids right now being affected, but what are you seeing as a doctor in the community right now?
So I only treat pediatric patients, so thankfully we are seeing very few number of children that are being admitted to the hospital with severe respiratory symptoms. From an adult standpoint, I know that we're having many more adults that are being tested that potentially are symptomatic. From a pediatric standpoint, I do hear a lot about, I get a lot of calls from the community about patients who potentially have, like I talked about, those symptoms, the mild to moderate symptoms.
Real quick, are parents worried when their kid throws a fever because he might be having a flu, he or she, and are they coming in scared?
So what we're really trying to do is have people call providers before they come in. We don't want you just to show up into an emergency room or your doctor's office without talking to the provider's office first. Our children are hopefully going to have much less likely to have severe symptoms, and they could just have their normal cold and respiratory-like symptoms. So the good majority of them are going to be able to stay at home and just be treated symptomatically with supportive care. So rest, hydration, and really trying to prevent infection into adults from children.
Thanks, Doc, for being with us today. Appreciate it.
Thank you for having me.